Let's do this. Today we are going to talk about DeQuervains syndrome, or texter's thumb. So if you watched my video last week about DeQuervain syndrome, DeQuervains is actually very similar, but it's in your thumb. So DeQuervains, again, muscles here are tightening, pulling on that tendon, yeah? So it's just very similar to the DeQuervain syndrome that we talked about, but your wrist is different. Your wrist has a sheath that goes around it. So you've got this sheath that wraps around your wrist. I keep looking at my computer because that's where the picture is for me. Imagine this is your ulna and radius, this is your forearm. This is that wrist sheath that wraps around the two. This is your tendon. Radius and ulna, sheath, tendon. Tendon goes underneath that sheath and normally sits like this, right? So it sits across the bone. What happens when you are constantly texting or using your thumbs, you are pulling on this tendon. You're pulling and you're pulling and you're pulling, right? Because just like I said with DeQuervain syndrome, but look what's happening to that wrist sheath. It's rubbing. You're creating a lot of friction between the tendon and that sheath, and that's where the inflammation comes from. Ow. As I said, the stretchy part of the constantly using the muscle is very similar to DeQuervain syndrome. The difference is that sheath that wraps around your wrist. The sheath is there to help prevent friction. So otherwise, DeQuervains is very similar to tendinitis and all over. Biceps tendinitis, DeQuervain syndrome, very similar to tendinitis. It's the sheath that it keeps rubbing against. It makes it different. Fascinating. You're still on camera. Oh no. So in order to do the test, you have to kind of understand the tendons that are being affected in DeQuervains. So I'm going to try to show you here on my hand. So you have this tendon here, and then this one here. And both of these might be a little sore, but it's going to be this tendon that we're really looking at. Really important thing to know before I get into the exercises, if you're in the acute stages, meaning if you're feeling a lot of pain, pretty consistently, you might not be ready for any of the exercises that I'm going to show you. I will let you know when you should stop. And the main thing here to remember, again, like just like with DeQuervain syndrome, is RICE, rest, ice, compression, and elevate. You can put your thumb in a splint to help remind you to not move this joint, to stretch here, to work this muscle and tendon too much. You can put your hand in a splint. That would be the compression portion of that. Again, the biggest thing to do is to not try to use it. A splint will help with that as well, encouraging rest. And ice is super important to decrease that inflammation. Most recent studies show that getting cortisol or steroid injections into the area and bracing it are some of your best options, but I will show you some exercises as well. So what happens is you get pain at the base of your thumb. So that's the first symptom of DeQuervains that you might notice, is pain at the bottom of the thumb, but that could also technically be arthritis. So you have to do a couple other tests. Okay, so our second test for DeQuervains is going to look like this. Place your hand on a flat surface, let your thumb be at rest. You're gonna push on that tendon, right? This one right here runs from your thumb up into your forearm. Push on that tendon, lift your thumb. If you feel pain, release, then you probably have DeQuervain. So you'll place your hand here, put pressure, lift your thumb. You might feel a little tenderness. It's the inflammation. You can do the other way as well. So again, pressure here, thumb goes out. You might feel it. Again, you're just trying to flex this tendon so that you can feel the pain kind of isolate where the pain is. So the third test, and I actually used to teach this in my yoga classes. We called it King Texter at my yoga studio. What you'll do is you'll take your hand, fingers face out, thumb is up, wrap your thumb into your palm, and then wrap your hand around your thumb like a really bad punch. And then you'll pull your pinky back toward your forearm. So you just pull it straight down, and you might feel that here if you have DeQuervains, because you're really stretching. And remember, if a muscle gets really tight, it's not used to being stretched so much. So you'll really feel that stretch. So that's the third test. So you've got just pain in general at the base of your thumb. You've got those other tests with the pressure and lift, pressure and out, and then king texture. Those are the three tests that you can do to see if you have DeQuervains. The pain will be the most prominent. It's not like, oh, it hurts to stretch it this way and I have DeQuervains, what do I do? You'll feel it. It hurts a lot, pretty consistently. So if you feel like you're ready to start working on some physical therapy exercises for DeQuervains, I'll show you a few. One is a cross fiber massage, quite simple. So you're just going to place your hand on a flat surface, 2 fingers here, and then just massage the tendon, right? You're just going to rub. That's it. That's all you're doing. You can do this for up to 20 minutes, though that seems like a really long time to just sit and rub your wrist. You know, it's something that you can do if you're sitting on the couch. Just make sure you're on a flat surface so that that tendon isn't being overstretched or worked too much. If that makes the pain worse, if you're rubbing and your wrist and you're just, you realize that it's making it feel worse, stop and ice it. That is one of the main things. This is one of the first things that you can do to help treat DeQuervains. And if this is too painful, stop what you're doing, ice it, put your hand in a splint, give it more rest, give the tendon more time to become less tender. Katie, can we not lick butts on the couch? Thanks. Another treatment that you can do, that if rubbing the tendon itself is too much, which makes sense because that's where the pain is, you can feel, so you're about halfway between your wrist and your elbow here, and you can just kind of walk your fingers closer to the wrist, and then you can move your thumb around and you can feel the tendons and muscles moving as you move your thumb. Here, you can feel it. Once you feel it, since you now know what muscles are being tightened constantly to pull on the tendon that's creating that tension, massage these muscles. Allow these muscles to relax. You'll even find that if you can push on the muscle, right? If you can feel it, hold that muscle, you might be able to stretch a little bit more because the tendon is actually being released a little bit so that you can stretch through that space. So if this is too much, you can always move down here and massage out the forearm. Something else you can massage, bone talk. If you hold your elbow still, you can still rotate your hand down, right? Hand is up, hand is down, elbow's not really moving, shoulder's not really moving. There's a muscle in your arm called a pronator, and it kind of crosses your arm, and that's the muscle that allows that pronation and supination in your forearm to happen in your hand. So the pronator is actually directly related to the thumb, because if you think about it, the thumb is driving down first. And so all of that is connected up here. So you can even massage up into the pronator. You can take a ball and you can rub that. I've seen people take highlighters and rub that into the area just as like a myofascial release to help encourage the release of that area. So you can massage here in the pronator and down here by the wrist, where the actual muscles that are being used, that are being tightened every time you text or something, use your thumbs. That's that too. If you do that massage, do it for about 30 seconds a couple times a day. The next thing that you can do, you've done this, it doesn't hurt. That's a good test of the where your tendon is at. So you've done that, it doesn't hurt. The next thing you'll do is take your hand and you're just try to reach your thumb down to your pinky. See how you're just stretching through that space. Thumb to pinky, thumb to pinky. This might be really difficult for you if you have really tight, if this is all very tight and inflamed. So just go as far as you can. I would recommend doing this 10 times, 3 to 4 times a day, or 10 times every hour, depending on, you know, your work day or whatever you can work your way up to. When this is pretty easy for you, you're not really feeling it anymore, what I recommend, we'll take whatever this is. My mom made it for me. Place your hand on something that helps you elevate your wrist. And what you'll do is you'll take king texture, so thumb in palm here and wrapped, and then you'll stretch and then release and lift. Try to keep your hand pretty level. So lower and lift. So you're tightening it to allow it to stretch a little bit more. Tighten, stretch a little bit more. You notice how you're not holding the tightness. So the next thing we'll do, place a hand on the tendon and you'll push, just like you did with the test. You'll push and lift and release. You can go up, but you can also go out. So pressure out, release, pressure out, release. This might hurt a little. And if it hurts a little, that's okay. What you're trying to do is reconstruct the tendon. There might be some scar tissue in there, might be some inflammation. So you're just helping to get the tendon nice and ironed out, essentially. So allow that to happen. But if you feel too much, oh, it's my hat. I was like, what is that? If you feel too much pain, then stop and ice, of course. When that starts feeling better, or when you start feeling better, you can keep the pressure on the whole time. So this is, again, when you start feeling better a few weeks down the road after you've been doing this for a while. So be very, very gentle, move very slowly, listen to what your body is telling you to do. Okay, there's 2 exercises that are recommended to strengthen the area. So the first one that we'll do is you have a weight. This is a 3, it might be a little heavy, but the idea is to keep it nice and thin. So a dumbbell is actually quite nice. What you'll do is gently and slowly lower the weight down. So notice how you're letting gravity stretch out the tendon, and your other hand will help the weight back up. So basically, if you're into weightlifting, you're focusing on the negative. In weightlifting, the negative is when you go down to reset to find the flexion of the muscle, or the flexion of the joint to pump the muscle. We're working on the negative, the strong, controlled elongation of this tendon specifically. It's called eccentric strength training. If you're into strength training, I recommend working on eccentric strength training. It's pretty cool stuff. Again, 3 to 4 times a day, about 10 to 15 reps per time. The last one that I recommend, pretend this is a rubber band. It's my hair thing, but pretend it's a rubber band. And you'll do something very similar to that eccentric. It is actually eccentric strength training. So what you're gonna do is open quickly, try to keep that rubber band on the tips of your fingers, and then slowly lower. This is a little bit stretched out, so it's kind of hanging, but almost like you're making a puppet face. Open fast, slowly lower. Open fast, slowly lower. And again, 10 to 15 times, 3 to 4 times a day to help get rid of that pain. It's going to take a long time. Any kind of tendon injury is going to take a while to try to fix. There's just not a lot of blood flow in tendons and ligaments. That's part of the reason why we do that rubbing, is to encourage blood flow to the area. So you're just encouraging the blood flow, which incidentally is how things heal, through blood. I hope that helps, and bye. Thanks.